And gives you an opportunity for you to interact with us using our various social media platforms. Not forgetting we have a WhatsApp number where you can also send the traditional SMS text. Once again, I'm Robert Chirabo Nyonyitono, and this is Good Morning Uganda Agenda. Now today we are going to be handling a topic that has brought, an issue that has brought the world to its knees once again. Looking at what is happening in Europe, looking at where some countries are banning flights from entering because of one thing, that is COVID-19 and now the Omicron variant, which is not that lethal as we know, but actually has high transmissible rates. And joining me in studios this morning is the Assistant Commissioner in charge of vaccines and immunization at the Ministry of Health, Dr. Alfred Duruware. Doctor, indeed, it's a pleasure having you again in our studios, more so with just 2 days left to wind up the year.
Yes, it's always my pleasure to be at UBC to share information with our fellow countrymen and to keep updated so that we do not relent in our effort to contain this disease. So I'm happy to be here.
Talking about efforts to contain the disease, as we speak, we are seeing various countries. Europe, it's worse. We are seeing how they're almost heading to a lockdown in some countries. Like France, some have even had restrictions. Here in Uganda, we are among the countries that the United Arab Emirates said we don't want flights from your country as of now, and we are seeing increasing cases. Briefly, give us a picture of how we are standing as a country in terms of COVID-19.
So it is always good to make reference to where we're coming from. Uganda had adopted a very stringent way of containing the disease. As you know from the word go, our objective as a country was to flatten the curve. Flatten the curve meaning that you may keep the numbers as low as possible, and if the numbers are kept as low as possible, scientifically what it means is the numbers of infecting individuals is also very low. And in that way you keep the numbers low and the risk of exposure of vulnerable groups is also kept low. In that way, the numbers of deaths would be low. The number of spikes, the number of waves will also be low. And as you might have already known, that other countries, even in our neighborhood, are now moving into wave 5. But we're still anticipating our third wave, and I think finally it has arrived. So the stringent measures we have taken have saved us in terms of deaths. And if you see our numbers of deaths, they are down to about 3,000 compared to other countries. You know, Uganda is very honest on its figures. If it is bad statistics, we give it, because this gives the impetus for people to appreciate risk and take the necessary requirements. So the measures which we have taken basically have been social distancing, and if required, enforcing social distancing through lockdown. Number 2, public education, to ensure that there is hand washing, to ensure that sanitizing is done, wearing of masks. Now, these interventions helped us up to early this year. Now, when vaccines became available, we added the 4th layer of protection, which is through vaccination. Now, unlike what most people think, actually our progress on vaccination is very good. I saw a daily carrying some funny stories.
That the vaccines are due to expire.
Those are baseless. So our uptake of vaccines has progressively been very, very impressive in the sense that in Uganda, in some regions in Uganda, you have up to 82% of people who are expected to be vaccinated. For example, if you go to Kabale, the Kigezi region, when we vaccinated there, 82% of people who are above 18 years are vaccinated.
82%, that is in Kigezi.
82% Kigezi region. If you go to Teso region, there it is 68%. If you go to Lango, it is 77%. If you go to Acholi, it is 52%. In West Nile, by yesterday, it was 61%. Now, if you move in the Toro, Bunyoro region, all that belt is above 50%. And Kampala is above 50%. Our focus now, which is ongoing, is the Ankole region, where we are still below 50%. But all the vaccines required for that region are already there, and the efforts are ongoing. By the end of the first week of January, we expect not less than 70% in Ankole region. Now, the area where new attention will now be focused are the uncovered areas along the eastern border with Kenya, starting from Busoga, moving all the way through Toro and Karamoja. This was also informed by our local evidence.
First, Doctor, let's understand, these are interesting statistics in terms of levels of vaccination. But what is causing the differences where Kampala is not doing well and you find parts of West doing well? Because one would expect vaccines are readily available in Kampala than there are in these areas. Then also, maybe if it is information about vaccine, people in Kampala more privy to this information. So what is causing these disparities?
No. Kampala has very good coverage. So Kampala has very good coverage. Its coverage is above 50% as we speak. For Kampala, I haven't gotten the specific figures, but Kampala and Kampala, Mukono, these ones are above average. So the difference you are seeing is a difference in design. The design for this campaign was made in such a way that when the second lockdown was lifted, ideally some of the regions continued with the transmission, high levels of transmission of disease. So instead of having a regional lockdown, which is very unpopular, we talk about it because we have no choice. The lockdown in those areas were lifted on condition that we intervene immediately with the vaccination. So that's why we started in Teso and Lango. Just to be specific about Teso, by the time we went there, the hospital was admitting 40 people per week with a severe disease which required oxygen. And their daily consumption of oxygen was 100 cylinders per day. So you can see the strain. So when we vaccinated, 3 weeks later, that number 40 went to 3. Only 3 people were now coming with admission. So we now have local evidence that when you vaccinate, you actually put a big dent on severe forms of disease. And it is possible, as I prefer expressing, that you could easily have a silent epidemic. It is even more interesting that if you look at Who are these people vaccinated in Kampala? The people who are 50 years and above. We have over 50% of them fully vaccinated. So
that is very good news, because these are the most vulnerable group we are targeting. But doctor, we also receive reports that there are people we could be cherishing and proud of huge numbers, but there are people that are getting vaccination cards, yet they're not being vaccinated. Have you heard of this? Are you investigating? What are you doing about this?
Now, this borders on crime, and that is police work. But for us, what we do, first of all, who are you deceiving? You're deceiving your own self. So you'll get the answer yourself. But it is something which is unfortunate if there are people who are doing that. But ours, as service providers, is to continuously give information, to arm the citizenry with the information to make responsible decisions. I do not think that a person who forges a card can stand in front of his family and present himself as an intelligent person. That is irresponsibility. And if we have credible information on that, action can be taken. But as we move towards implementation of mandates in the long run,
mandatory vaccination.
Mandates, mandates meaning that whereas someone is exercising that kind of reckless freedom, I don't want to be vaccinated. Fine. The mandates are saying for you to go to certain places, you are not entitled to putting other people at risk. So, if you move to a church, now your freedom is going to create problems for other law-abiding citizens. The church will be free to say, hey, you are taking your freedom too far. Can I see your card?
So it is up to you. No one is coercing you to get vaccinated.
Yes.
But the mandates require you
Exactly. It is not about refusing the vaccine, but you also take it all along the way. For example, smoking is dangerous to your health, and smoking in public space in Uganda is illegal.
It's prohibited, yes.
It's prohibited.
But it's your right to smoke.
It's your right to smoke, if you do. But myself, I have a right to say, you who is a smoker, sorry, there is no space for you in my house. Will you take me to court?
No.
Precisely. So what is going to happen is public places, ours is to protect public interest. If you are going to be making decisions on your own to take or not take vaccines, then you should follow through with all that is associated with it. Start your own church, start your own school, start your own market, start your own bus company, start your own. And that's going to be the way of enforcement.
Let me ask you, Doctor, regarding this. You've said it is not mandatory vaccination. It is mandates, but technically one would take it to be that way. It's just playing with the English language, maybe. Because if you tell someone that it's okay for you not to get vaccines, it is very okay.
Yes.
If you don't want, don't get vaccinated.
Yes.
But mandate requires that for you to access public places, you should be vaccinated. I just love the jargons.
If you come to my home and you find me eating my traditional Lubara food, and then I say, hey, karibu. And then you say, I don't eat what you are eating. And then shortly you're coming back to me, you say, I want to eat. Now I must provide what you want by yourself. You are making it very complicated. So I think the point is that we know that vaccination saves lives. We know that vaccination prevents severe disease. And if you choose not to be vaccinated, you are prepared for those consequences on your own. But also remember that when you get severe disease, you are admitted in hospital. It is not your money which is going to be used.
Most of the times people go to
taxpayers' money which is going to be used. That's the bigger picture. And that's the picture we're protecting through mandates. So you will realize that more clarity will be given on these issues of the mandates in future, and or in the subsequent discussions and engagements. But I'm just preparing the minds of people who are taking the issue of getting vaccinated lightly. For example, Ministry of Education is very clear. If you are a teacher and you're not vaccinated, please don't come to interact with people's children.
It's your right not to be vaccinated.
Yes.
But the mandate is, it mandates you that if you're to teach,
yes,
you must be vaccinated.
So it is your right.
So no one is forcing you to get vaccinated.
It is your right to say, I'm not going to get vaccinated.
And no one will coerce you into that.
But you must also take the responsibility of not going to places where that law applies. So I say, okay, I'm going to resign from teaching. Then that's okay. I don't want to get vaccinated, and I'm not going to teach. So here is my resignation. Nobody's going to pursue you. But there are many places like this which are going to be gazetted to ensure that the public is safe. This is not a personal health.
But then, Doctor, how is this going to be enforced? I know Ministry of Health do not enforce laws, but you're looking at the practicability of this as people behind this. How is it going to be? Because for the teachers, there are those that are teaching in private schools. Maybe the school director is not vaccinated. The headmaster is not vaccinated. The school proprietor is not vaccinated. How practical is this? Markets, if it's a public place, it's a market. Who is going to ask for my vaccination card?
Government is big. Actually, this should not even be government business. This should be civil society business. The people must rise up and say, my child is going to be in this school. Is it safe? Actually, this should be people's issue. The government sets the rules. The private sector and other public sectors implement those rules. But the people should be demanding more from those institutions through civic action. So we have got the PTA there. We have got the board there. We have associations of private schools. We have inspectorates of schools because all schools are in districts. So the mechanisms for government to do its business and enforce lawful regulation, it's very, the structures are there. So it will only take one parent to complain. One parent to complain. Then it's the whole school system is subjected. Now, the certificates we are going to use, I want to repeat, are not these ones which you can easily forge. They are electronic certificates which are verifiable. So there is no shortcut in this business. And I just encourage those who are tempted by the devil to go and forge. Is that not stealing really? So those who are tempted to do those kind of things, the chance is still there. The vaccines are now available. You go and get your jab. It is better to be partially vaccinated than being caught totally unvaccinated with a certificate. I had a very interesting conversation with one of our members of parliament when she was traveling to Tanzania for the sports event. So in our conversation said, now I'm not vaccinated, should I get vaccinated? I said, no, vaccination is not a requirement for travel, but testing is, so test. But remember, you are going to interact with other people in sports, so the risk of infection is high. So the issue should not be the requirement for travel, but your own health. Now, they go and come back, they're infected. Thank God, she has very mild symptoms. She's isolating. And yesterday we conversed and we had a very good laugh over it. I said, you see my point? So, do not do these things of vaccination because of the rules. you do it because of the benefit it has in terms of minimizing the effect of the disease on you, effect of the disease on your family. I think all of us were here when we
had this second wave. Doctor,
yes.
This brings me to yet another question.
Yes.
You're in charge of vaccines and immunization. Globally, there's an issue of boosters. Uganda as a country, what is our take regarding boosters? We are seeing many countries, most of the Western world now moving for booster doses.
Now, the good news is Uganda has also adopted boosting as one of its strategy. Look at it this way. Now, COVID vaccines are new, and as we implement, we continue studying the benefits of the vaccines. What is clear as of now is that the immunity which is acquired through vaccination wanes off after 6 to 8 months. So people who were vaccinated more than 6 months ago are not as effectively protected as those who, as they were a month or so after vaccination. So as the immunity wanes down, you require to boost it to take it to a level where it is the antibodies are high enough to protect you. This is really the background. So as we, as this evidence has accrued, countries are now beginning to give boosters at least 6 to 8 months after they had completed their last dose, the primary series. So we are going to start doing this as a country. We started vaccinating in March, so it means those who vaccinated or who completed their doses in May, they are now beginning to be due for boosting. They are now due for boosting. But as I've always emphasized in our previous discussions, COVID-19 vaccines continue to be scarce. So the boosting will not be done indiscriminately. We will boost people the way we started our prioritization. You remember? We had people who are 50 years and above, people with comorbidities, and those are the ones who are going to start boosting. Because the evidence also shows that the waning of immunity is faster in those age groups. And therefore, there is need to boost them with additional doses 6 months after they completed their vaccination program.
Well, let me remind our viewers that you can be part of the topic of discussion this morning by simply going to our various social media platforms. That is our WhatsApp number 0709 60 25 92, and Doctor will be replying to your concerns regarding vaccination and of course other questions there. We have Dr. Alfred Uruwari, who is the Assistant Commissioner in charge of vaccines and immunization at the Ministry of Health, with us this morning. We are looking at COVID-19 mandatory vaccination. That is said it is your right, but remember, there is a mandate. So much as no one will hold you accountable for not being vaccinated, you must be vaccinated to access certain places. But also, Doctor, as we get these replies coming in, let's also look at this Omicron. There's so much being said. Actually, some Ugandans are worried. We cannot preempt the president's speech. He has to speak Friday. But I'm looking at the medical aspect from your perspective as a medical doctor, as a person in charge of vaccines. This Omicron seems to be scaring many people. Are we safe? Some are anticipating even maybe there could be a likely lockdown if this rate of infections continue.
You know, scaring is a survival instinct. So people are scared in order to survive. So if you get any event and you're scared, it is an instinct to self-preservation. So when people are scared of something new, I'm okay with that. So what is important is, what do you do with that scare? I think there are some facts about these diseases which we need to start now working on our psyche. There are people who are expecting COVID to go. Where do you want COVID to go? Has HIV gone? HIV came with all superstitions, right? And we have lived with HIV. Where you lived with HIV through promotion of condoms, through abstinence, through swallowing of ARVs. Now, this is how you live with it. You live with the COVID by also doing similar things. By wearing your mask, by taking a vaccine. Now, if you see the ARVs and the vaccines, they do similar things. ARVs reduce symptoms. ARVs prevent you from death. The vaccines are doing a similar thing. They reduce severe forms of the disease. They prevent against death. So, these are new diseases. Their ways to disappear are not for now. We will live with them. But the way to live with them requires behavior change on our side, attitude change on our side. So we should only be expecting. Now for COVID, you are seeing very rapid mutations. The original virus which we are dealing with is not the new one now. The new one, when it comes, they fight amongst themselves. The old one disappears, the new one comes. So these kind of changes can be either to our disadvantage or to our advantage. Now, if Omicron mutates and it tends to be milder, it tends to be milder than Delta, without celebrating, someone can say, hey, this mutation seems to be to our advantage. So the Omicron variant is a variant of concern, basically because what you saw with the mutations were around the antigen which is targeted by our vaccines. That was the main concern. That if these changes will make our vaccines ineffective, then we would be back to zero. This was the main concern around the Omicron. But fortunately, what we're observing is the signs and symptoms are lower, although it is more aggressive in attacking. It is in fact spreading more efficiently than others. So that is another story. So when Ugandans are scared because of Omicron, I think being scared is not enough. That scare should translate itself into behavior change in terms of social distancing, sanitizing, masking, and vaccine uptake. After all, the vaccines are still found to be protective against Omicron itself.
Doctor, let me look at some of the questions we have. Here is, hello doctor, thanks for the show. What are the effects of vaccination on people with complicated health like hypertension and nervous system failure that mostly attach to the brain? He didn't give his name. Then also another person sends a message saying, well explained, mandatory vaccination. Thank you, doctor. But he's asking that are you sure vaccines are everywhere and easily found or accessed? Please give us your name and place where you're watching from so that we can know properly who we are communicating with. Another question also is just thanking you, doctor, for explaining very well that is mandatory vaccination. But he says that this is a smart move by government. However, he's worried that before government could have taken this move, I think they should have availed vaccines at every point of this country. Let's first handle those in the interest of time. Okay. Finally, there's this one, an SMS. Thank you, doctor, for sharing on COVID-19 mandatory vaccination. But this person is wondering, he says, when is the booster vaccine commencing? That is somewhere. Let's have those and we'll then wind up.
Okay. Now, COVID-19 has a spectrum of manifestations. We now know this. About 80% of people who are infected will have no signs and symptoms, although they are efficient transmitters to people because they are mobile, they continue with their work. Now, we did an assessment of people, who are the people who have died. And let's not make any mistake here. The people who have died in Uganda with COVID, have been people with high blood pressure, diabetes, heart disease, kidney disease, cancers, pregnancy, people who are obese, and so on. Now, when we say people with the comorbidities are a priority to be vaccinated, it actually speaks to that narrative. That if you are in poor health, COVID will have severe illness on you. COVID is likely to take you. So the severe disease must be mitigated by vaccinating you. That's why from the beginning we started with people who had underlying health conditions. So please, if you have your Mukade there, he has this blood pressure and he is also very old and so on, vaccines should by now we should not be talking about that group, because for nearly a year now we have been vaccinating that group, and we have just opened to 18 years this lower group about 2 months ago. So I think this is to emphasize the need to ensure people with comorbidities are vaccinated. Now, for vaccines, as I speak now, vaccines are all over the country except in these regions which I mentioned where we have not reached with campaigns. Karamoja, the Tororo area coming through Mbukede, and some isolated, some few districts in northern Buganda region. Otherwise, we are everywhere in the country, and by this week, we are going to take vaccines to these regions, even if they are not conducting it at the scale of a campaign. The vaccines will be available to ensure that those who are due for second dose get their second dose. That has been an issue, a long-standing one. We have agreed and resolved on that. The vaccines will be reaching.
And quick one, we look at the booster issue.
Now,
Samuel asked.
The boosting, the policy position has been taken. Now, what is remaining is for us to orient the district health teams. These are things which you need to bring the understanding of the healthcare workers. We are very many. You need to bring them on board because we don't want to take any chances. The guidance on boosting is going to be provided to the districts. And when you present yourself for a boost, the health workers should be able to give it to you.
Okay. Well, Doctor, in the interest of time, let me have your final remarks regarding that is mandatory vaccination and, of course, COVID as we prepare for the reopening. Right.
So my final remark is to the effect that the COVID-19 situation in the country is progressively getting worse, in the sense that we used to report about 150 cases per week, but now we have gone to 900 beyond. We used to have 1.5% of people who were tested found positive by yesterday. We're at 17. So which means the numbers of cases are moving. So whereas we are now in the mood of easing, we should not be easing any restrictions. That's our expectation. We should not be in the mood of letting down our guard. Even if the restrictions are eased, SOPs will remain in place, and we need to comply. And vaccination is one of those key pillars for our response. I encourage you to take your vaccine and also present yourself for your jab if your complete vaccination ended 6 months ago.
Well, I want to thank you so much, Dr. Alfred Uruware, who is the Assistant Commissioner in charge of vaccines and immunization at the Ministry of Health. Very clear, he says it is your right not to be vaccinated and no one is going to coerce you. But there will be restrictions to access these places. So if you choose not to be vaccinated, it is up to you to have your own world. Government is not going to arrest you for that. However, they are going to put restrictions on places that unless you're vaccinated, you access them. Very interesting. Mandate and mandatory. Here he has explained them very well. Have a lovely day. Ruben is very smart, prepared to give you all those interesting stories in the world of sports. Till tomorrow, stay safe, celebrate, enjoy responsibly. We want to see you in 2022. God bless you.
Live from UBC Studios in Kampala, this is Good Morning Uganda. It's the festive season and we love it. And that means it's time to celebrate with GoTV.
Come with me.
So get your GoCoder and GoTV value for 25,000 shillings to watch with the whole family. And if you're feeling extra festive, upgrade to our best package yet, GoTV Super.
Something to look forward to.
Download the My GoTV app for more information.
Super.
We all deserve a super festive season. And with GoTV